Welcome back. Well, you probably noticed today is National Wear Red Day.
February is National Heart Month. It's a time to reflect on your heart health, and we are going red for women to raise awareness about heart disease and stroke.
And joining us this morning to talk all about it, Dr. Nandita Gupta, a cardiologist at OHSU, and Mary Kay West, a heart attack survivor. Thank you both for being here this morning.
Thank you.
Thank you for having us.
Yeah, Mary Kay, tell us what happened here with your heart attack.
So January 2019, totally out of the blue, began experiencing symptoms, and as it turns out, I had a heart attack caused by a spontaneous coronary artery dissection. It's a mouthful, also known as a SCAD, and totally out of the blue. I was a competitive athlete, healthy and fit, no underlying heart health conditions, and 25 years ago, there was no research being done into SCAD. And so thanks to AHA-funded research, the outcome of my heart attack is very different than it might have been.
Yeah. Now, did you brush off your symptoms at first, or did you think this might be a heart issue?
No, I brushed them off,
Yeah.
and oh, it's gas or it's indigestion, and don't do this. I actually drove myself to the hospital.
gosh.
They don't recommend that.
No. Well, but you were just, you were in good shape and everything, so just
Yeah.
had no reason to think that. So, Dr. Gupta, why is it especially so important for women to get this message out that it is affecting a lot of women like Mary Kay?
I think it's very important for women to recognize that heart disease is the #1 killer in the United States. Despite all the advances in healthcare and science, 1 in 3 women is expected to die of heart attack. Every 82nd, a woman dies from heart disease.
Oh my gosh.
So it's important to know that it is not only a disease of older women, but also young women are affected. And when a woman has a heart attack, she's more likely to die than a man. So I think all these numbers highlight how important it is for women to advocate for themselves and be aware of their risk.
Have you seen in your practice the behavior that we saw with Mary Kay, this, oh, it's probably nothing, I still got to take care of the husband and the kids, and women just kind of put this stuff off?
Very true. And that is also actually scientifically proven. So it's not only something that we've seen around us, but it's also been proven that women in general tend to seek help later and tend to do worse after a heart attack. They're often underdiagnosed and undertreated, so not only are the patients themselves, but even the providers, the physicians, the healthcare professionals do brush it off. The awareness about heart disease as a cause of death in women is significantly lower than it is for men.
Yeah, why is it such a greater risk to women? What is it about women? Is it because we hold in stress more, or what is it?
I think it's a combination of factors. So women outlive men. So inherently women carry a greater disease burden from heart attack. On top of that, they seek help later. There are certain risk factors that are unique to women. For example, adverse pregnancy outcomes. If a woman has high blood pressure or diabetes or has preterm birth, she's more likely to have heart disease, and awareness of that is lacking. Then when women are aware and then they do present, they're often underdiagnosed and undertreated, underrepresented in clinical trials.
Yeah.
So I think overall sense of awareness in the medical community, amongst patients, amongst physicians, needs to be higher.
Now, Mary Kay, you've since gotten involved with the local Go Red for Women movement. Real quickly, what can people do today to help join and become more aware?
Well, I think first of all, they can join us in wearing red today. And then if people would like to learn more about how to take care of their heart and get involved, they can go to www.pdxgoesred.heart.org.
All right, well, ladies, thanks so much for coming in and sharing your story, Mary Kay, and also
Thank
Dr.
you.
Gupta for sharing just the symptoms and why this is so important for women. And to take more action and learn more about this story, of course, just go to KOIN.com.
Yeah, we've got that link and much more on our website now. We want to go now to Kelly Bayern. She is keeping an eye on that forecast in her red today. Kelly?
I am. I love how everyone is wearing red for women.